In this video, we are going to go over the recommended movement precautions someone should take after their hip replacement surgery. It is important to note that different surgeons may recommend different precautions. In order to follow this video, it is necessary for you to know what surgical approach the surgeon took for your hip replacement. Please consult the discharge instructions given to you from the hospital or contact your doctor if you have any further questions. First, we will discuss the hip precautions for a direct anterior surgical approach. There are three main precautions to remember if your surgeon uses this approach for your hip replacement. 1. Do not place your leg behind your body. This is otherwise known as hyperextension. 2. Do not turn your toes outwards. Keep them pointed straight or inwards at all times. And 3. Do not move your leg out to the side. This is otherwise known as hip abduction. Next, we will be going over the hip precautions for the anterolateral, posterolateral, and posterior surgical approaches. It is important to note that these approaches may have different variations based on the surgeon and the surgical approach. There are three main precautions to follow after your hip replacement. These precautions can be easily remembered as CBT. No crossing your legs, no bending at the hip, and keep your toes pointed straight. It is important to check the precautions that your surgeon gave you to ensure that you are following them correctly.